Matthew Holt on the VIVE show floor. This is Mark Clermont. He is the CEO of Cecelia Health. That's Cecelia Health. Fancy booth. All right, so Mark, first question. What is Cecelia Health?
Cecelia Health, founded in 2009 as a diabetes management company, over the years has since transformed itself into an adherence-based program licensed to practice medicine in 50 states and also supporting life sciences patient support program.
All right, so you say you're licensed in 50 states. Tell me about the network of providers, nurses, physicians, coaches. Who's in that network and what do they do for patients?
Yeah, multidisciplinary. Again, we're focused on chronic diseases. So we've expanded from, again, started with diabetes, expanded into cardiovascular disease. We're now in COPD, CKD, obesity, some mental health, etc. Composition of the network is largely RNs, specialized RNs, and then expanded in a group of endocrinologists, nephrologists, etc., all in support of specialty clinic.
And then what is the typical patient experience? I know you have a couple of flavors of patients you're working with, but some of them come through a health plan, and you mentioned a number of the, tell me a couple of the health plans who are sending you patients, and tell me what you're doing for those patients in general, how you're working with the plan.
Yeah, so some progressive health plans doing some great and fantastic things, leveraging us. Health First, for example, long-time relationships for us, working both in diabetes and cardiovascular disease. Specifically, hypertension is the most recent manifestation of that, looking to expand that into CKD this year as well. Excited about that. What do? They send us this roster of patients that are hypertensive. We reach out, communicate, and just try to help them understand how it means to live with hypertension, how to help get their numbers under control and live a healthier life. Sounds like a really simple lifestyle thing, but a lot of things intercede with that. A lot of life intercedes with that. It can be technology, it can be different drugs, it can be confusing messaging, you name it. More and more it's difficult to manage yourself and your chronic disease and slow its progression, and especially so in this day and age with the pandemic.
So your team there is supporting those individual patients. What are the outcomes for the patients? What are the outcomes for the health plan? Tell me a bit about what the impact is on both sort of clinical outcomes and on costs.
Yeah, sure. So there's traditional measures: reduction in A1C, stabilization, time in range. Those classic diabetes measures. What we care most about actually is adherence to therapy.
Right.
And so if after 12 months, 83% of your population is adherent to their therapy, regardless of whether it's a hypertensive drug, whether it's a hyperlipidemia-based protocol, you name it. After 12 months, if 83% are adherent, that's unheard of. Right. Number one, I'm not sure I've seen anybody reporting numbers like that, but we have those numbers. And so you can translate that into cost of care reduction, you can translate that into all manner of different outcomes and measurements, but reality is it impacts HEDIS scores, of course. They care about that. It impacts gaps in care closure. They care about that from a plan perspective. We care about the fact that patients are getting better.
Fantastic. All right. Now, you tell me about 70% of your business is actually not with health plans, it's with the life sciences companies helping with their patient support program. So, is that different, or is that basically the same thing but done for a different client? Yeah,
I mean, this is the great revelation of Cecelia Health: is you can deliver that baseline level of, say, call it subclinical care. I mean, it doesn't rise to the age of diagnosing, treating, and prescribing, but there's this whole roster of care that patients really appreciate, and life sciences enables that in patient support programs as well as in the extension of their clinical trial activity. So, so you think about this rubric of patient-centered medical home. We're basically rewriting the nodes of that, what that means to put the patient in the middle. Insert life sciences, the patient support programs. They're paying for care, this level of care. It's technical, it's patient safety care, it's emotional support, etc. It's goal setting, you name it. Things that kind of fall within coaching, things that kind of fall within care coordination, but there's so much more to it that helps people survive and maybe even thrive with their chronic diseases.
Excellent. So that's about 70% of your business. Let's talk about the company for a second, just for the last couple of questions. I don't recall, but you guys have raised a little bit of money, but not some of the gazillion-dollar rounds we've seen. But tell me a bit about the funding and how the company's growing.
We're supported by a number of fantastic investors. SJF Ventures is led our A round. We have a family office in 3B Holdings, Eric Edidin, that supported us in our B round with Boston Millennium Partners.
How much did you guys raise?
So we've raised about $23 million to date.
Almost nothing by today's standards.
Almost nothing by today's standards. And you know what? If you can be capital efficient with this,
absolutely,
you can make a lot happen, and we're making a lot happen. We'll see what happens later this year.
So tell me about the scale of the company. How many patients are on the system? How many employees do you have? Just give me a sense of the scale and how you've been growing.
Yeah, so I mentioned the network's roughly 300 clinicians deep.
Are they 1099s? Are they employees? Are they part-time? How does that tend to work?
It's a mix.
Yep,
it's a mix. They're employees where they need to be employees.
Right.
And then we have 53 business-related folks, all who kind of keep the glue together. Fully virtual. We're thriving fully virtual. We're a virtual-based company. That's what you do, right? So that's the scale of the company, and we're going to keep on moving.
All right, fantastic. All right, we're into with Mark Clermont, CEO of Cecelia Health, and catching up on what they've been doing in the world of both chronic care management, but also patient support activities for life sciences. Mark, thanks for your time.
Yeah, thanks, Matt. Appreciate it.